My name is Dave Butler, MD. I'm an orthopedic surgeon at Crawford Memorial Hospital. I specialize in adult reconstruction from my fellowship year, and that involves joint replacement, anterior approach to the hip, knee replacement, shoulder replacement, as well as general orthopedic problems. I could tell you a little bit about the anterior approach to the hip. It's an old approach to the hip. It was initially begun in the 1800s, but it wasn't used for hip replacement. It was used for pediatric problems and infection. So that approach was carried out when hip replacement came in the 1950s and 60s. Some people kept up with the anterior approach, and later the results showed very good outcomes and some low complications, and it started to gain popularity. And that was in the early, starting in the 80s and 90s, but then really in the 2000s when it took off in our country for anterior approach to the hip. And I pursued learning about it by making multiple trips to the surgeon on the East Coast that I learned from Dr. Kagey's, his uncle and John, and got to scrub with him and do cadaver labs with him, and eventually learn how to do anterior approach to the hip. And then I became part of my practice, I think in 2009 or something along that line. I don't think, that's been my main way of doing total hip replacement. Patients like it. It has certain advantages. It allows them to avoid worrying about precautions, which is really nice when we do it after somebody breaks a hip. Occasionally we have to do partial hip replacement, and people get up in the age where they can't follow directions easily. It's harder for those people to have that complication we worry about. But just everyday patients that need to get hip replacement tend to like it. It allows them to rehab themselves and get along up moving a little sooner and better. And the surgeons like the anterior approach to the hip due to the fact, for some different reasons, but we like it for some of the problems that we sometimes can avoid with it. But it's a nice procedure if someone needs to have a hip replacement, and it's certainly gaining popularity in our country. It's up to, I think, 30 or 35% of hip replacements aren't done that way in our country. Knee replacement has changed with implants and how we fix them to bone. We're starting to do a little bit of technology changes, and that's evolving. And shoulder replacement has changed as well in the last 5 to 6 years. So we're talking maybe 2015 and 16 reverse shoulder arthroplasty, and is really up to 80 to 90% of the shoulder replacements in our country are now being done as a reverse shoulder arthroplasty, which is, nobody really predicted that when they came out in 5 or 6 years that it would become the predominant way. But generally speaking, people like that, the outcomes, and the surgeons like the outcomes with that. Conventional shoulder replacement that we, like a hip, it's a ball and a socket joint. The shoulder is described as a basketball and a teacup. In reverse, they put the ball on the teacup side and put the socket on the humeral side, on the arm side. So it's a reverse of what Mother Nature, and that's the way the human bone structure is. So that's why they call it a reverse. It happens to be. But it has, when sometimes people have deficient rotator cuffs, and those are the muscles that are needed to move that joint, this type of reverse shoulder allows to compensate for that in a much better fashion. And then the outcomes after the surgery are generally very, very desirable. So it's really taken off in our country, the amount of, when people do need shoulder replacement, what kind's being done. It's nobody really predicted that. What kind of things I'll be seeing here at Crawford Memorial Hospital or the orthopedic clinic, the kind of problems they see for everyday orthopedic problems, from simple twisting and turning of an ankle, a painful knee that began out of nowhere, a difficulty putting shoes and socks on, soreness in the groin, limping when they're out walking too much. All these things might be developing arthritis. Somebody might want to have these things looked at, x-rays done. All those things are things that we routinely see and evaluate. And I'm excited to be part of the Crawford Memorial Hospital Healthcare team, and I'm looking forward to taking care of you, and looking forward to being part of the Orthopedic Center and Orthopedic Treatment team here to provide care for you.